This video is going to be about the lower airway anatomy. And some important things to know from it. We're going to talk about the trachea, the bronchi, the primary bronchi, and then that's going to get into the bronchial tree. I'm going to talk about the alveoli. That's where gas exchange happens, and then we're going to mention the just the thoracic cavity and its contents. So let's get to it. Let's talk about the trachea. Now, if we have our human, and here's going to be our head, nose, chin, down. Bring the head back and just, there we go. So our bronchi, or our trachea, our trachea is our anterior, the tube that's on the anterior aspect of our throat. And right behind it is the esophagus. And the esophagus is a very narrow, very closed tube. So if you can think of this as the walls collapse whenever it's not in use. Now the trachea, I'm going to start talking about that here. The trachea contains a lot of cartilage. So let's write that here, trachea. It's got the C-shaped cartilage rings. And it's got approximately 15 to 20 of these. Now they're C-shaped, right? Which means they're not completely encircled. And these start just below the glottic opening. And now what do these do? The whole purpose of having this C-shaped cartilage is for protection. In my last video we talked about, like, if you got throat punched, right? Someone's gonna hit you. Protect against that. It also protects against collapse and expansion. When we take a breath in, we create a negative pressure that wants to collapse structures. Without these C-shaped cartilages, the rest of it is smooth muscle and mucous membrane. So there's not much structure to either of those tissues. And so if we breathe in, the negative pressure is likely to collapse our trachea. When we breathe out, the positive pressure we generate would want to push that out. So that's why we have the cartilage there, to provide structure and to provide support. It's open at the back so that when you swallow food, your esophagus can expand, right? It can expand and push against the posterior. This is the anterior, that means towards the front. It can push against the posterior wall of the trachea and allow that food to go past. One thing to mention here, when we're looking at the smooth muscle and the mucous membrane, the mucous membrane, this is all about protection as well. Smooth muscle can constrict or dilate in response to stimulus. Hot, cold air, allergens, to stimulus as well. You know, like sympathetic stimulation will cause smooth muscle relaxation or dilation, because it's the fight or flight, so you're going to need more oxygen to do more work, and so it will dilate that airway to allow more air in. And then obviously the mucous membrane secretes mucus, and it also contains cilia, and that will further trap particles that enter into the trachea. And those cilia, so the mucus traps it, and the cilia will actually sweep it superiorly It's where it can get swallowed, either spit out or swallowed in the esophagus and exposed to the stomach contents. So that's the trachea. Moving down from the trachea, we get into the bronchi, or the bronchial tree. And this starts this huge network. Here's the trachea, and it's going to separate into the right and left primary or main bronchi. This area where it separates is called the carina. And that's the part where if you get a droplet of water that touches that, it's going to make you cough like the living daylights. It's very painful, but that's how important it is to keep stuff out of your lungs. Now, something to note, this is the right, and these are called bronchus, right? So bronchus is the singular term. Bronchi is the plural term. So there's the right and the left. The right happens first, so bifurcates before the left, and it's a bit larger. And now these right primaries, so we have a primary bronchi, and they are going to branch into secondary bronchi. And the right side, let's change this up. So the right side has got 3, because it's got 3 lobes, right? The left side has got 2 secondary bronchi, because it's got 2 lobes, right? It's got a superior and an inferior lobe. The right has a superior, a middle, and an inferior lobe. When they enter the lung, the actual lung tissue, these secondary bronchi branch out into tertiary bronchi. And where these secondary feed the lobes, these tertiary feed what are called individual bronchopulmonary segments. And your right side has 10 of these, and your left has between 8 and 9. There's some changes that happens as you age, stuff starts fusing together. Now, each of these tertiary bronchi further divide several times, and they divide in what we call bronchioles. And these bronchioles will further divide into what we call terminal bronchioles, and then these terminal bronchioles further divide into what we call, respiratory bronchioles. And these are the ones that lead to the alveoli. And so these are getting smaller and smaller. As we divide, they keep getting smaller and smaller. And as they divide, something to keep in mind, they get smaller. They contain less cartilage until they get into these respiratory bronchioles and they have no cartilage. Sure I got that right. Yeah. No cartilage, and they have smooth muscle. So that tells you that their main mode of protection down here is the sympathetic parasympathetic stimulation, to where it's going to cause broncho constriction. And this is if it's stimulated. I'm sorry, that's if it's not. And then bronchodilation. It would be parasympathetic. And this is sympathetic. We can talk more about that later. If you're in, I'll mention it quickly. If you're in fight or flight mode, you're going to need more oxygen. You're going to be doing more work. And so you're going to want your airways dilated to allow more air to flow in when you take a breath. So that's why it's called bronchodilation. That's why it's sympathetically stimulated, right? The sympathetic nervous system takes over for that. All right. Now, in what I've read, these tertiary bronchi, each one branches into approximately 6,500 of these bronchioles each. It's pretty crazy. And their size is between 0.3 to 0.5 micrometers. Now, if you remember from a previous video that I did, your nose and your nasal cavity will trap particles around the size of 10 micrometers, right? Which is still really small, but could you imagine something, 20 times the size of that getting into one of these airways, and it would completely obstruct it. You're talking about just a speck of dirt or sand or something like that, some dust. And then you imagine that in issues like asthma, where asthma causes smooth muscle constriction, right, your smooth muscle, and it causes mucus production, that a little bit of constriction and a little bit of mucus in teeny tiny airways like this could easily obstruct them very quickly. It doesn't take much. All right. Now we're going to get down into the alveoli. You know what, that's good enough for right there. That's 12 minutes, about 13 minutes. I'm going to stop right there, and I'll make a last video just so these don't get too long.